upon You Can Call Me Mr. Beyond. We are having a conversation on important health education that can improve the well-being of people in our community with a focus on the residents of Brooklyn Park here in Minnesota. The first part of the program will discuss some of the prevailing health concerns in our community, including heart diseases, blood pressure, hypertension, obesity, asthma, and cancer. We will also discuss some of the statistics by the CDC to buttress the situation of the prevailing health concerns in our community. In the course of the program, we will learn about some of the lifestyle habits that can help improve the overall health and well-being of the residents and their families, as well as available resources that could help residents navigate their health. My guest today is Dr. Grace Totoe. She is a medical director and managing partner at Minneapolis Health Clinic, a primary care clinic with a focus on wellness, lifestyle management, disease prevention, medical weight loss management, medical exams for state disability, as well as treatment of medical conditions. This education broadcast is by the kind courtesy of the City of Brooklyn Park's ARPA funding program. Thank you everyone for joining us. But for now, please help me welcome Dr. Grace Totoe to the program. Dr. Grace, thank you so very much for joining us on African Let's Talk. The first thing we'd like to know is, can you highlight some of the health conditions that are mostly prevalent in our community, that is the minority community, especially the African and the Black community?
Thank you for having me. I'm happy to be here. Some of the conditions that are in the Black community may not be too different from what is prevalent in the US or in the Caucasian community. The main difference is the Black community tends to ignore their health sometimes. And so the health problems sort of festers and then it becomes more complicated. Whereas if they had showed up much earlier, complications could have been prevented and things would be more managed. So currently, the public health concerns are mainly cardiovascular, and then we have the cancers. And then there's also diabetes, which is an endocrine condition, but a big one. Under cardiovascular, we have heart disease, what we call, heart attack, the MIs. Heart disease, we have problems with blood vessels, with the aorta, the big blood vessel that supplies blood to all the other parts of the body. Problems like that can lead to strokes, which is the condition where a part of your body stops working because blood supply to the brain stops. We have heart failure, which is when your heart is not able to pump enough blood and oxygen to other parts of the body. So you have problems with breathing. And a few other cardiovascular conditions. You can break it down into a whole lot. Even add kidney disease, because blood pressure can add to kidney disease as well. And then we have diabetes, which is also another condition that is very prevalent. It's common in Africans, again, because we don't show up and we don't get checked up every year. In some people, it's missed, and they show up when things are advanced. Diabetes is one of the conditions that can affect almost every system in the body. Then you have your cancers, which is the common ones will be the colon cancer, which is common in the African race. We have breast cancer. We have cervical cancer, which really is preventable. But unfortunately, some of us did not get the vaccine. The vaccine that is prevents cervical cancer, that is given here between the ages of 12 and 26. Recently, it's been extended to about 45.
Wow.
And so, And so if you're 45 or not 45 yet, you may still qualify when you show up for a gynecological visit. But this vaccine has been shown to prevent cervical cancer. you know. Mortality outside of the US is almost close as 50%. So
Wow.
it is a deadly cancer, which is preventable. There's also things like ovarian, pancreatic, that may not be as common, but these are the big ones.
These are the big ones that affect people in our community. So with regards to the different conditions, from the heart to the diabetes to the cancer, what do you think are some of the general causes of these health conditions that mostly affect people?
Well, I think a lot of things contribute to this. First of all, I think lifestyle with respect to cardiovascular medicine. Lifestyle is certainly a big one. And so what we eat, lifestyle, I think genetics certainly contributes. If you have bad genes and it's passed on, you're certainly at high risk. Smoking is another big one, but fortunately we don't smoke that much, Stress levels definitely contributes to cardiovascular disease, especially the high blood pressure. That contributes to lack of sleep. Substance abuse, alcohol may be big with us. Sometimes we may even drink, but we don't feel like we drink too much, So alcohol certainly contributes. Lack of exercises, obesity, all that plays a role in the diseases. In terms of, and then definitely environment. I mean, if you're in an environment where you're exposed to certain chemicals that make you at risk for even, let's just say, asthma, right? And in an environment where it's super dusty, say you're close to an industrial region, the chances that you develop some reactive airway that could potentially affect you much later in life is high. In the same way, if you live with people who are smoking day in, day night, even if you're not smoking, it could affect you,
Wow.
Right. And then, let's not forget mental health, because mental health is also another big one that is out there in the community. And the sad thing is, we don't even talk about it. People, especially the men, when you recognize it and you bring it up, they will say, no, I'm not depressed. But that's also something that's out there that needs attention.
How much about also the food that we eat? How much role does it play in some of these conditions?
The food definitely plays a big role. I mean, if your daily consumption of salt is high and you have risk factors, you are bound to have elevated blood pressure at some point. So salt intake is something that is very moderated if you have high blood pressure. Right? If you eat high cholesterol foods or high fatty foods, the chances that you will get high cholesterol is high. High cholesterol puts you at risk for heart disease, other conditions, including strokes, So what we consume in our bodies definitely does play a role in who we become. You are what you eat is actually true.
Yeah, I think for so long we've heard it, and sometimes it almost becomes like a cliche.
Right.
But it looks like it. Yeah.
If you are not making healthy choices and you become obese, it gives the opportunity for all the other metabolic problems to go off in your body or to be accentuated in your body. Your body cannot regulate insulin use. That's when diabetes come in. If you're big and you're not sleeping well, because when your neck size becomes thick, you develop sleep apnea. You stop breathing sometimes. That puts you at risk for blood pressure. Blood pressure puts you at risk for strokes. It puts you at risk for heart disease. So they are all interconnected, and they all have to come down to what you put in your body.
What you put in your body.
Which also includes what you inhale, especially smoking, which contributes about 30% to strokes.
So even if is it for those who only smoke or those who actually inhale it from someone else who is smoking?
Well, if you smoke, you're certainly taking the bigger risk of it. But if you are a passive passive smokers, you don't smoke, that there's some risk of lung cancer there.
Question is, statistics according to the CDC reveal that people in some racial and ethnic minority groups actually experience higher rates of poor health conditions and diseases for a range of health conditions. What could be the reason for this situation?
I think some of the reasons would be because they don't show up, and so screening doesn't happen. That's one reason. And they don't show up because there's always a reason behind why people do some things. They may not be showing up because of the lack of trust in the system. One, because they may have experienced some discomfort, some level of maltreatment. And so it makes you feel like, what's the point in showing up? Because nobody is going to help me. So that's one. The other thing too is our way of life, the things we know that have been passed on from generations, right? For instance, we know that soul food is supposed to make you feel good. The way we cook, we know that we're supposed to fry certain things. That's what our grandparents taught us. And so that's what we've done. But in time, studies have shown that deep frying may not be as healthy. And so we have to modify some things. For instance, Collins, you and I are from Ghana. And the way we cook, what we eat, staples are huge in carbs. Our main staple is carbs. The men have to eat their fufu. They have to take appetite, maybe 2 or 3. The soup has a lot of salt. So it's just the things we know, Yes. There's lack of exercise. We're not conditioned to think that, okay, our body is important too. Whatever we put in it is important. So we have to exercise. Exercises have shown to reduce stress. It can reduce your weight. All that can go to decrease cardiovascular diseases.
Yes.
Right. And then I was also saying that relaxation, wellness, finding time for our wellness and social connections and all that also help, including taking care of our mental health. So you realize that for the Caucasian population, sometimes it almost looks like they have been conditioned such that they pay attention to all of this. I feel like when it comes to minorities, either because we are preoccupied with the activities that are needed for survival, and that means that maybe we don't have the luxury, but we can at least try. Maybe we don't have the luxury because at baseline, we're thinking of what we're going to eat, how we're going to get our 3 meals. And so we don't have the time to pay attention. So we just focus on work and we just focus on how we're going to make money to take care of our family and all of that. But in between all that, there's simple things that we can do, like go for walks and relax and even do breathing. Spend 10 minutes thinking about how the day went and relaxing. Those are some of the things that will help us, Wow. We probably don't do that. Most people don't, Yeah. And so I think that not showing up is what we eat and not showing up, and obviously genetics contribute a lot to ultimately the diseases that we affect us later in life.
The next thing that I would like to look at is lifestyle and choices, of course, are among the factors that influence or impact the overall health conditions of people, as we have mentioned, or as you have talked about. So when we are actually making lifestyle choices, what do we have to keep in mind? I know we live busy lives here in Minnesota, in the city of Brooklyn Park, especially in the minority community. We live busy lives. People are working 3 jobs and, of course, not taking break and all of that. When we are making lifestyle choices, what would you suggest we have to keep in mind?
Well, so when we talk about lifestyle choices, I think the biggest is eating well. And eating well means that having a plate that has food in its balanced proportions. So we are eating some fruits, we are eating some vegetables, we are eating some protein, we're eating some carbohydrates in the right proportions on a plate. And that's one. Healthy proportions, healthy choices. If we want some alcohol, we're drinking in moderation. Okay. And it's not just alcohol. Alcohol falls under substance abuse, which is one of the things that is being abused. Fortunately, our population, the Black community, when we talk about the African immigrants, things like marijuana and cocaine may not be, the hardcore recreational drugs may not be our lifestyle. But in other African communities, it may be marijuana, in moderation. Marijuana does have some medicinal value, yes, but everything in moderation. Okay.
Absolutely.
So we've talked about food, we've talked about substance abuse, we've talked about sleep, lifestyle. Sleep is extremely important. Adult, you need at least 8 to 10 hours of sleep. You need to sleep well, you need to rest well so that you can get up and function. Okay. Exercise. To maintain, you need at least 30 minutes of some moderate activity. It could be brisk walking, could be just light walking. 30 minutes of some activity every day for at least 5 days, just to maintain, to keep things going. Obviously, wellness also includes some social connections. So healthy social connections definitely is healthy for you. So whether it's your church, that if it's church support or friends, find time to socialize. Those things. Being isolated doesn't also help. That's when mental health comes in. And if you're stressed out with your mental health issues, ultimately it will show up in your body with, in different manifestations. So those are the few things. Obviously, financial health and all that is important, where, shelter and all that goes into health, ultimately, because it could potentially play a role under, stress and what type of diseases you're exposed to, including infections and, lung conditions and all that. So those are some of the lifestyle changes that is important. But I think the ones that we can control is really what we put in, the food, and making choices. Those are some of the things, and the substance abuse, the alcohol. Those are the things that we can control. So we can control what we can control, and we should control what we can control. Genetics we may not be able to control, but if you do know that you have a high predisposition because your mother had conditions in their 50s and their 40s, you know that when it's time to show up. Honeybee is free for everyone.
Wow.
So you can go there if you don't have insurance. There are also free clinics in the community. There are free public health clinics in the community. There are clinics that get grants to help people without insurance. And so stop procrastinating. Just show up and go for a wellness check at least every year, once a year.
Once every year.
And some things may be identified that we need follow-up. And then you just follow up.
Wow, that's amazing and great information. Right. Obviously, people have said, "Oh, we live very busy lives in our community," and like you said, maybe lack of insurance and sometimes lack of knowledge. So we actually tend to ignore the need to undertake these practices. So thank you so very much for throwing more lights on the need to actually do health check. But for somebody who is probably still thinking about it, how critical is health check in the overall health of a person? Because I feel like if I don't feel sick, why do I need to go and have a health check?
Yeah, so, I think most of us make excuses to show up. I mean, I've done it in the past because I was busy. But you should know that it is extremely critical, because if you're waiting to feel something, that's like you getting closer to death.
Wow.
Yeah. Blood pressure, hypertension. You don't feel that you have hypertension. When you start getting headaches, it means your blood pressure is to the roof. you may not feel it until it's too late. So that's why you should show up and get checked up. It's always best to catch things early, because medicine has come so far that when things are identified early, we can actually manage it. Sometimes even eradicate whatever it is.
Wow.
And change your course, the disease course in you. If you don't catch it early and you wait till it's late, you may show up at the time, like cancer. If it's pancreatic cancer, which typically you may not even feel anything until it's advanced, But if you show up in talking to your doctor, some things may be off, and some things may, even because of your family history or some things that you've been exposed to, they might have it at the back of their minds that I need to keep an eye on this for this particular person. And who knows, you may be experiencing something that might come up in conversation. Those are not even things that are screened generally. But whilst talking to them, if there's a concern or you say things that are red flags, they might probe into it a little further. And we're using pancreatic cancer because that's one of the conditions that when you present late, there's really nothing that we can do, And so if this is caught early, say stage 1, and they see it, they can do surgery that buys you a whole lot of time. If they are able to make sure that it hasn't spread, that's life-saving right there. And so that's why it's important to get closer to a clinic or a medical provider. Ask questions, don't run away from the service out of lack of suspicion. If you don't think that you can trust somebody that doesn't look like you, find somebody that looks like you and go see them.
Like you. Yes.
And trust that they will tell you the truth.
Yes.
But you have to show up.
You have to show up. Very, very important. Wow, I cannot thank you enough for sharing this important information. All the time, it's always on my mind, on my heart, that we need to continually digest this information and really take the necessary steps to control our health and be able to take good care of ourselves. So we truly appreciate that. Before I will let you go, and I know you've mentioned it in most of the conversation, but in summary, what are the specific general lifestyle changes that you believe can help people to improve their healthy lifestyle or to improve their health, especially people in our community?
There are a whole lot of healthy choices that we can make, but under broad headings, I think one thing, or the 4 things that I will say is 1, healthy eating.
Healthy eating.
Make sure you are shopping the right way. If it's possible to cook your own plant-based foods, cook. You can control the things that go in it. So if you have the luxury to afford that, go for that. More fruits, more vegetables. That's important. Okay.
Yes.
Exercise. And that means move. Don't just
move the body.
Exactly. Move the body at least 115 minutes a week. Spread it how you want it.
Yes.
But, exercise to the point where you are sweating, or increase your heart rate a little bit.
Wow.
Try and get good sleep.
Good sleep.
Try and sleep. Control your stress. Find a way to manage it. If it's too much, find help and talk to someone. Otherwise, find time to breathe. Exercising obviously will help you with your stress, but find a way to de-stress and control your stress.
Your stress.
And then the last thing I would say, make healthy social, actually that's not the last thing, healthy social connections.
Healthy social connections.
Right. And that means find some support group. Either it's church, either it's friends, but healthy connections, people that you can talk to when you're having a hard time.
Yes.
Social support, it's important. It goes into wellness. So that's something that I think we all need to have. Isolating yourself doesn't help.
Doesn't help.
It's how mental health develops, depression develops, can lead to suicide. It can lead to a whole lot of things that will probably be for another topic. And then show up at least once a year. Let them screen you for, the common cancers, because that's what's recommended, And so screening when you're at the age, screening for colon cancer, screening for breast cancer, screening for cervical cancer. All those things are important. If you show up, they will check blood work to make sure you don't have diabetes, you don't have high cholesterol. If you do, this will be followed up. There are medications that can control these things.
Yes.
If you follow up and your BMI, which is the number that is used to check whether you're obese or not, if your BMI is over the roof, there are medications these days, there are FDA-approved medications to manage obesity.
Wow.
Yeah. And so if you have pre-diabetes, which is your diabetes manifesting a little earlier, if you're pre-diabetes and you don't control it, you will definitely become diabetic one day.
Yeah.
So when we catch you in the pre-diabetic stage, we can manage it and decrease your risk. That is life-saving right there.
Yes.
And so there are a whole lot of conditions that affect us. If you have asthma and we detect it, we'll manage it. So the important thing is to establish care somewhere. And show up once a year. That's not too much. These days, you can even do telemedicine. You can stay in your house and go, I don't feel like going to the hospital, so I'm just going to do telemedicine. Just call and talk to someone. As you talk to them, if they have concerns, they will advise you on what to do. But pay attention to your health. I think that's all it comes down to. Be cognizant of the fact that your health is who you are, and your body, and if you don't protect those things now, you're going to have problems later in life. So as you plan your estate, how are you going to take care of yourself and your kids if you're not taking care of yourself, of your body, if you don't have the energy? In America, healthcare is expensive. So if you wait until things are advanced, how are you going to pay your bills? So prevention is actually better than cure. And that's also very true.
Yes, it's not just a cliche.
It is not a cliche. These are very important points. You need to show up and prevent all these things. It's an investment.
All right. Thank you so very much. Before I let you go, your concluding remarks, and also I know you are very much engaged in the community. If you can share information about how people can reach you. Of course, somebody may be watching and listening. They're like, oh, my goodness, I need to really take the next step. And if you are available to help, how can people reach you?
Well, so I'm the medical director of Minneapolis Health Clinic. We are located in Golden Valley. And our telephone number is 763-496-5703. If you Google Dr. Grace Totoe, Minneapolis Health Clinic, I will certainly come up. When you go to our website, there's a way to request for an appointment. You can just fill our form. Our schedulers will call you and get you in. It's very straightforward. It's very well streamlined. And then, we'll take it from there. Yeah.
Wow. Thank you so very much. Do you have any concluding remarks for us as well before we go?
Well, again, it goes back to the community. Let us take good care of ourselves. There's so many, healthcare has come far. And so you don't have to wait until things get complicated or things are very advanced. So show up, identify medical problems early, and then you can hopefully grow up in a healthier way to enjoy your life later. If it's retirement, that's your goal. Show up so you can enjoy retirement.
Wow. It's very important
now for the future.
For the future. Yeah. But that is what we are all fighting for.
Exactly.
We are fighting, working hard for the future. So very good advice. Thank you so very much for your time and for the great insights that you have shared with us and the information. We truly appreciate your time.
You're very welcome. Thank you for having me.
Thank you so much. Bye-bye.